Hello, everyone, and welcome to our second spotlight session featuring nursing's department. Thank you again for taking your time to come in this afternoon. My name is Tracy Pham, and I'm one of the county's recruiter. I'm honored to be here. I'm honored to be your host for this special segment. With me on the stage are three incredible guest speakers: Lorinda Gomes, administrative nurse; Eunah Kang, OR managers from a corner hospital; and Irie Rivera, one of our critical care staff developer, and he's from Valley Medical Center. We are thrilled to have them here with us today. For the next 45 minutes, we want to bring you the most valuable insights to help your nursing journey. Please note, today's session is being recorded and will be available for viewing after. Come on in, we still have plenty of seats up here in the front. Come and join us. Yes, thank you so much for coming. We will start off with introduction and take a closer look at the county health system. Why it's such a great place to start your career. You will hear from our speaker about their journey, culture on the units, career path, training program, and job opportunity. And we will wrap up with some live Q&A, so please save all of your great questions until the end. Our team will also be available after the sessions to answer any question. So to help us understand our audience who's joining us today, let's do a quick show of hands. Who is here exploring healthcare or nursing as your new career path? Can I see the hands? Great. How about who's thinking about making a change or taking the next step to advance your career in nursing? Excellent. Well, whether you're new to your career journey or looking to advance, the county offers many opportunities for every stage of your career. Now, without further ado, let's hear from our panel of speakers. We're going to start out with Eunah. And hi, Eunah. If you can please introduce yourself and share with us a little bit about you, the departments you oversee, and what kind of inspired you to join the county.
Hello. Hi. My name is Eunah Kang. As I was introduced, I'm OR nurse manager, overseeing O'Connor operating room department. How I joined the county. The county mission is aligned with my personal belief, better health for all. I hope that you see my hat. It says Seeing Again, Guatemala. It's from the medical mission that I participate. We restored the patient vision through cataract surgery. So personal belief in the county great mission, I decided to join the organization that helps my personal belief, exercising. I told my boss I should have volunteered, but I get paid, so I love my job. It's been 5 years since I joined the county.
Thank you, Eunah. Lorinda, please introduce yourself and share with us your long nursing journey.
Good morning, or good afternoon. My name is Lorinda Gomes, and I'm a registered nurse, and I've been a registered nurse in the state of California for 38 years. I started my nursing profession, like many of you, as a graduate of Mount St. Mary's University in Southern California. I migrated here to started my career as a med-surg nurse, med-surg onc nurse at Stanford, at the Children's Hospital of Stanford. I was really passionate about caring for children and caring for and learning the disease process of oncology. Now, for some of you, those 38 years, you're not even 38 yet. Somewhere here in the Bay Area, med-surg and Stanford and UCSF merged together, and then they demerged. So I went into the merger as a nurse manager and came out the merger at UCSF as a project manager, focusing on workforce planning, registered nurse expansion into programs, and recruitment. I really enjoyed the different role I had outside of the clinical arena. I really enjoyed talking to new nurses and people who were interested in following the path that all of us have taken in choosing nursing as our profession. On that path, I thought, I need a little more education. I don't know enough. I have a lot of clinical expertise, and I can talk to you about oncology, and I can talk to you about med-surg, but I didn't know all the laws about hiring, firing, and expanding a workforce. I went back to school, earned additional education, and then sought an opportunity with an organization that was aligned with my values. Having started at Stanford and gone to UCSF, I thought to myself, this was around 2000, where everybody in hospital leadership was telling us, we have to do healthcare like the private sector. We have to do healthcare like the for-profit industry. We need to know how to make healthcare profitable. And I'm like, profitable? Does that really make sense to me? But I took a leap. I actually went out of healthcare. I said, I need to learn how the private industry works. And I said, as a nurse, I know I have transferable skills. One of our biggest transferable skills is what? Our communication. Communicating with people and So I sought an opportunity in public relations. So I became a public relations manager, had nothing to do with nursing. But I used all of my nursing, my ability to assess, plan, evaluate, and reassess in my new role for public relations. So my theories of nursing and my nursing models, all that I had learned, I took with me to a non-nursing role, and I flourished. But I wasn't happy. I wasn't happy because I wasn't in the environment that I had initially chose. But I got that information, I got that education, and exactly 1 year after being in that organization, I joined the county almost 24 years ago as an administrative nurse, working for the director of nursing, and at that time it was just Santa Clara Valley Medical Center and its clinics. So of course, I've been with the county for 24 years, and in my role as an administrative nurse, I really feel like I've had 4 different jobs as an administrative nurse within the county. And I think that's one of the highlights of my tenure here at the county is the number of opportunities available to me, and I'll be speaking more to you about the opportunities available to you.
What an amazing journey, as you can hear.
It's not over yet. It's not over yet.
But what you can hear from Lorinda is that transferable skill. The transfer skill will get you never know where it lands you, right? So, Irie, if you can please introduce yourself and share with us how you joined the county. You've been with us for a little bit over 10 years.
Yeah, so good afternoon and welcome everyone. So my name is Irie Rivera. You can call me Irie. I've been with the county since 2015. I actually started my career off in PCU, spent a few years there. My big thing is all about learning, knowledge, gaining knowledge, skill acquisition. So I decided to further my career path and go to medical ICU. Spent peak pandemic there and then transitioned to critical care staff developer. I've spent the past 10 years, encountering people, mentors that have built me to the person who I am today, but also trying to make sure that I help others realize potential that they have so they can also do the same. So again, thank you for being here, and excited to tell you more about our stories.
Thank you all to our incredible panel speaker sharing about their background and their nursing journey. It's inspiring to hear the diverse path that brought them here all today. As you can see, behind every role in our county system is a shared mission, a commitment to public service and improving the health of our community. It's what guides our work every day. So I'm going to tell you a little bit about the County of Santa Clara health system. We are the California's second largest county-owned health and hospital system. That's including our behavioral health services, our public health departments, Valley Health Plan, emergency medical services. Under the Santa Clara Valley Healthcare, we have the 4 acute care hospitals, Santa Clara Valley Medical Center, O'Connor Hospital, St. Louis Regional Medical Center. Regional Medical became a part of the County of Santa Clara effective April 1st of this year. So we're so grateful to have a new facility join us. And under the Santa Clara Valley Healthcare, we also have the primary care clinics. We have a total of 14 clinics. And then we also have over 60 plus specialty service department. Not to mention, we also have custody health services under our County Santa Clara Health Service. So our mission and values, as you printed on there. So our mission is to provide high quality, compassionate, and accessible healthcare for all residents, regardless of their socioeconomic status and ability to pay. And our vision, better health for all. And we're serving a resident of 2 million people in the community. So now, let's learn a little bit about our hospital and our nursing units. So let's dive into what it's like working in the hospital. Let's start with Eunah. If you can share with us a little bit about working at O'Connor Hospital and overseeing OR department. What does your day-to-day look like on the units?
That's a lot to answer, but let me get to the from number one. So O'Connor Hospital, it has a long standing history. Just like the regional medical center, it became county system middle of its existence. I think it was 2019. I joined the O'Connor after it became county system. In O'Connor Hospital, because it has a long standing history, the quality and service was proven to the community with the current existence. And then I think a county added mission and value statement more for the public community. In the operating department, there is 11 OR suites. Currently, we operate 7 to 8 rooms at 7:30. That's like a day shift beginning. And then it reduced the number of the operating rooms due to the staff and then obviously need. I just want to put it out, the O'Connor operating room doesn't reflect all operating room in the acute hospital. Every hospital has a different layout or staff metrics and all the specialty they provide based on what their probably goals, objective, or the population they serve. But for O'Connor, it was a continue their service to the community plus county added on. So with the 7 to 8 operation, I think we did 742 cases in April of 2025. The monthly average is 645. That comes down to 32 cases per day.
Wow.
We do all specialty, like head to toes, general surgery, plastic surgery, orthopedic, cardiac, thoracic, vascular, endovascular, podiatry, you name it. We do all. Also, we serve the outpatient and inpatient. Outpatient is the same day surgery. The patient comes to the hospital the day of the surgery, and they go home after surgery. So my day shift comes at 6:30. They attend the daily huddle, which lasts about 10 to 20 minutes. Usually it's a general announcement or any change of the policy and procedures, or sometimes I devote to the certain in-service. It depends what is needed that day. And then everybody's go to their room. Each room has a different specialty surgery happening, and it comes as an assignment. So you will be assigned to one specific room. Each room will have a lineup of 8 hours or 10 hours. It depends what is placed there. So basically for whole your shift, you will have a different number of a surgery based on the whatever. Sometimes it will be just one long hours of a surgery, which is like usually brain surgery. It can be spine surgery. It can be just even 10 hours or 12 hours. So you'll be preparing that surgery, not able to finish that surgery by end of your shift. The evening shift will take over. So the hands-off, the communication is very important. If you have a shorter hours of a surgery, it will be, you can be doing like 2 or 3 cases.
Wow, that's amazing.
Yes.
I mean, that's a lot of inside information into our OR departments. We would love to hear more later on. And Lorinda, if you can please share with us a little bit why the county health system is such a great place to work.
So as was mentioned, we're a very large organization with multiple layers of acuity. So as you enter, how many of you have had a preceptorship or who've stepped into one of our hospitals as a care provider?
That's great.
How many
Wow.
have come into our hospitals or clinic seeking care? So you may realize that there's a lot of different types and levels of care. So we have specialties like the OR and the ICU and med-surg and pediatrics and burn and critical care and acute rehab, and we're recognized nationally, not just in our little corner of the world, not just in the Bay Area, but nationally for many of our programs. So when you ask me why would I seek an opportunity at Santa Clara Valley Medical Center or Santa Clara Valley Healthcare, I'm going to say for the opportunity to have opportunities. There are more opportunities here in the South Bay in our healthcare system than there are in any other healthcare system locally. Now, you say, well, the prestige, or do you have as much prestige and levels of care as Stanford or UCSF up in the, we do, because we're a different type of hospital. We're a different type of health system. We provide a niche that the other two systems do not. But we also have that high level of care. We do everything short of, and help me out in the ICUs, I don't think we do everything short of what we call ECMO. So we don't do, external storage. Do we do ECMO here in the IRCUs? So we do a very high level of care, but we also do a very high level of touch with our community. When we talk about the level of touch and connection that we make with our patients, for example, in our home health van. We have a van that goes out to touch members of our community who are unable to come to us, and so we go out to them in line with the vision. So many of the opportunities to have an opportunity, I believe, is here within Santa Clara Valley Healthcare and one of our either hospitals, clinics, community environments, public health. So if somebody asks me, why would you come, or why would you seek an opportunity? I would say you're seeking an opportunity here to seek more opportunities. I've been here 24 years. And for many of the nurses that have been with the county for as long as I have, it's rare to find a nurse who's had the same job for 1 year. He's already been here 10 years, he's had 3 different jobs. So again, your education, your passion to care for people, we have an opportunity here. And opportunities don't just mean specialty. opportunities also mean, what do I need in my life today? As Eunah mentioned, we have 8-hour shifts, 10-hour shifts, 12-hour shifts, day shifts, night shifts, weekends only, Monday through Friday only. So there usually an opportunity is available or may come up to fit the lifestyle you're currently living. You're trying to get an additional degree. You have 16 children. You are caring for your mother, your father, your grandmother, and you're trying to do everything and work as a nurse. There probably is an opportunity that'll fit your schedule within our very large organization.
Thank you, Lorinda. That's amazing. Irie, I understand that you have been with us for 10 years and have worked on multiple nursing units, including progressive care, critical care, ICU. We want to know if you can share your experience working at the hospital and how you advanced to your current role as a critical care staff developer.
Yeah, so just to touch, we are in the beginning stages of an ECMO program at VMC, but that is to come maybe next year. But just from my experience, so again, like I mentioned, I've been with the county for 10 years. I started as a new grad, as many of you probably are. And just to highlight what Lorinda mentioned, growth is everywhere. So as long as you're determined to figure out exactly what you want to do. Now, I know a lot of people step into the field not knowing exactly what your goal is. That's totally okay. I happen to be one of the lucky ones that knew what I wanted to do from the beginning. I got hired into PCU in 2015 in the fall, knowing that originally I wanted to be a pediatric PICU nurse. Going into adults was something that I didn't quite understand. But I was determined to be better and the best that I could possibly be. And as I was in our training program, actually the staff developer at the time is now one of our nurse execs at one of our hospitals, I told my colleagues, I want to do that. 10 years ago, would have never imagined that I would be landed here on the stage in that exact role. So that 10 years was all about building my knowledge, seeking opportunities, of which there were bountiful. I started off teaching HSAs in a skills day. We happened to build a new part of the hospital, did onboarding for a whole bunch of different classes, created lessons plans, collaborated different units, departments, and was able to kind of branch off from there. Realized that I wanted to do a lot more high acuity and be able to control my nerves under pressure. And what more than to go to the ICUs? Now, the unlucky thing is it was during pre-pandemic, not knowing everything that was going to happen. But honestly, with a growth mindset, it was everything that I'm sure I was not yet ready for, but soon to be ready for. And it's kind of build my skills to the degree that landed me in this job. So highlighting again, growth is what you make it. So as long as you're always seeking the opportunity to grow. Now, part of my job is to make sure that I break down the obstacles and barriers to make sure whoever comes into the enterprise and crosses my path has the opportunity to grow and find exactly what they want to do.
Thank you, Irie.
Can I just add a few more? On his growth mindset, I don't know if most of you know, but as a teaching institution, we're dedicated, the entire group, to further the education of our nursing population. As many of you have experienced being in a clinical environment in one of our hospitals, by Irie's experience, the training that we provide, we don't just give you the opportunity, we train you so you're successful in that opportunity. And I think that's something unique to Santa Clara Valley Healthcare, different from the other hospital entities in our community.
Thank you, Lorinda. That's a great touch. So you have heard amazing story and personal experiences from our panelists. Hopefully this story and narrative have been inspiring to you in some way. Personally, I truly inspired by hearing all this today. So let's make the room a little bit more exciting and explore the most exciting topics I think everyone's waiting for from our panel is talking about nursing recruitments, job opportunity, and into the training programs. So we're gonna start out with Lorinda. So Lorinda, can you also share with us a little bit about our nursing career path and maybe touch on a little bit about our clinical nurse classification series, level 1, 2, and 3?
Sure. So for those of you who are already licensed as an RN, raise your hands. For those of you who are licensed at LVN or CNA, okay, within nursing, all of those licenses are important. We do have opportunities for those who have a CNA license, who are wanting to earn more experience in the acute care setting. We call them hospital services assistant. Write that down or look that up. That's the job you want with us. For the LVN, we do call them LVNs, licensed vocational nurses. And then for the RNs in the room, we have a number of classifications that your RN license would meet the employment standards for. For a registered nurse without any experience, you just graduated last weekend, and you're like, I got my license, I'm ready to go, I passed the test. The classification you're going to look for is Clinical Nurse 1. So here within the county's Santa Clara Valley Healthcare, our entry-level RN position is called a clinical nurse, and we have levels 1, 2, and 3. Each level requiring additional experience in the specialty area. If you're a registered nurse and you already have 2, 3, 4 years of experience, but you're looking for a different role, do you have to apply as a clinical nurse 1? No. You need to apply. We have many specialties within nursing, right? We've mentioned them here. Everything from maternal child health to the OR to the ED to med-surg. Apply to the area where you have transferable skills. But if you're looking for an area like, I really am enjoying my clinical nurse experience, but maybe I think I want to be a care manager. Or I took an infectious disease class, and I think I wanted to be infection prevention nurse. Or you have completed an additional education, and you're ready for a leadership role. I've done some leadership at another hospital, and I think I want to transition as a assistant nurse manager or manager. I would encourage you to type into our browser the word nurse. You're going to get about 35 nursing classification titles. Those classifications will each identify the employment standards. But for our clinical nurse 1s with no experience, there's not just one area that you can apply to. There's multiple clinical nurse 1s that you can apply to. And I encourage you to apply to all of them. The one unique thing about the county is that we need to respond to your application. But unfortunately, we can't read your mind. If you apply to med-surg, but you have an inkling of maybe you want to do pediatrics too, or maybe the ICU or the OR, we're only going to review it for med-surg. So if you want to do ICU, the OR, and pediatrics, apply to all of them. My motto is apply.
And apply.
I'd rather see your name 14 times and know that, oh gosh, this nurse is keen on getting an opportunity here and is putting their best foot effort in many different specialty areas, not yet knowing exactly what specialty that's going to be your fit. Many of us come into nursing with a lot of different experiences. If you asked me 38 years ago, do you think I would be sitting on the stage as an administrative nurse? I don't think I could have predicted that. So apply, apply, apply. You don't know where your next opportunity will be, but with your skills, and you bring skills, and your knowledge, because you all have knowledge, in accordance with the certification you have, CNA, LVN, RN, valuable to this healthcare system.
Yes, and our job opportunity and our recruitment's posted on our website at sccjobs.org, so ensure to explore our opportunity. If you don't see something posted today, sign up for our job interest card, and that will announce and send you an alert when there's something open within your career interest or field, and ensure to sign up for our nursing newsletter. That would be great. Thank you, Lorinda. Irie, well, if you can also share with us a little bit about what opportunity the county support new nurses, such as the clinical training program.
Yeah, so part of my job is to run and facilitate the critical care training program. Now, the critical care training program is a program that has been going for years, before a lot of our careers actually even started. It has now turned into a 13-week program, probably one of the only ones in the Bay Area that is documented and as well-versed as ours is. So that 13 weeks contains about 4 weeks of didactic. So that means 4 weeks you're in class with me and the other critical care staff developer, and we are reviewing content, anatomy, physiology, pathophysiology, interventions, everything, whatever you name it, we probably cover it. And if we don't cover it and you come with a question, my goal is to make sure to get you an answer. Now, outside of that, the rest of the 9 weeks is clinical orientation. So we start out with kind of getting yourself used to the environment. You would be going into one of the units, the unit you were hired for, and understanding the flow, introducing yourself and meeting other interdisciplinary teams. And that would be done with a clinical partner. So that clinical partner would be an equivalent to a preceptor in your capstone. Now, the clinical partner's job is to make sure that you're practicing up to an expectation of your current limit. So if you're brand new, we're not expecting you to be perfect or an expert. Our goal is to get you there. And going back onto that growth mindset is making sure that you're improving with evaluations and kind of markers to meet every week. We alternate actually between 1 week in class, 2 weeks on the unit, 1 week in class, 2 weeks on the unit, and then the last few weeks are just all the units straight. We try to make sure we teach to what's happening on the floor, but the floor and the patient population that comes in can always vary. But we encourage everyone to come in with questions, experience, so that not just one person has that experience, but we can share it with the rest of the cohort in class. These critical care training programs historically have always been twice a year. Sometimes it's as small as 15 people. Sometimes it's as big as 45. It really depends on unit need. But it is one of my favorite parts of my role currently, is making sure that I can make sure that me, as a practicing ICU nurse, gets everyone coming in the same concepts and information so that they're ready to become experts as time goes on.
Thank you, Irie. That's an incredible wealth of knowledge into our critical care training program. I can't wait to share this recording with our job seeker who can't be here today, because that's one of the questions I receive every single day on the nursing inquiry. Lorinda.
In addition to the program that's run in critical care, we actually have programs that run in multiple specialty areas, similar to critical care but not exact. For every specialty, and Eunah can speak to what happens in the OR, it's a varied length on how long it takes to train you in that specialty area. So we take you from where you're at, where you come in with the experience you come in with, and we know what the experience you need to have. And Eunah, what is it, 1 year for the OR? Almost 1 year for the OR. Labor and delivery, also about 9 months to complete the entire process. Now, because one is longer or shorter, does it mean one that's better or worse? No. It's because of the opportunities you'll need for growth within that area and the type of programs that have been created. Now, the programs we use to train in our specialty area are national programs. So it's not a grow your own program and hope that you succeed. No, we use evidence-based programs that are associated with the AACN and other reputable certifications and certified organizations. So the education you receive here will be recognized in other locations. So, of course, we want you to stay. But we know that people move around, and when they hear you were trained at Santa Clara Valley Medical Center or O'Connor Hospital or St. Louis, they're going to know exactly the training you received because our training has a reputation for excellence. And people walk out of here and usually can get jobs in other organizations. And we're not saying we want to train you to leave, but we want to train you to be the best nurse you're going to be in the future. Many nurses are trained with us, stay with us, leave for a little while, and then they come back because they miss the environment that they're trained in. So critical care frequently runs a couple times a year. Med-surg frequently runs a couple times a year. OR and L&D, they're more like once a year. And we don't have the ICU program starts June 1. Because of the intensity of the program, the support needed to successfully bring all of you through the programs, we actually spread them out through the year, which allows us to put additional resources for each of the training programs. So again, applying to that Clinical Nurse 1 opportunity lets us know you're interested in that specialty area. And if there's an availability to train, that's the list, that's the group of people that the manager will get for people interested in critical care, in the OR, in the ED, in the different specialty areas throughout the systems.
Vacancy is very unpredictable, but as Lorinda mentions, we offer training program throughout the year. So ensure you sign up for our job interest notification alert, so that way when there's an opportunity posted, you'll be able to have an opportunity to apply. Majority of our recruitments are posted for 2 weeks, so there's a deadline for each of the posting. So Eunah, thank you so much for sharing with us. We want to know what other opportunity within OR that is currently opened, and besides RN opportunity, is there any other classification that the department staff or hire over the years?
So the surgery itself requires multidisciplinary teamwork. Because of that, I have various different job specifications. Other than RN, is a surgical technician, surgical aide, anesthesia technician, patient transporter, the obviously clerk, and then someone who does the billing and charge and supplies. We call the patient business service clerk. That's about under my care, but also other departments get involved for surgery, like laboratory tech. Sometimes it has to be present during the surgery. X-ray tech is another specialty that has to support the OR. First assistant, and even pathology, and the second MD is needed.
That's
at the
great.
same time.
That's great to hear. Well, I know that's a lot of information to remember. Therefore, we created many resource videos that covering applications process, tips and tricks for successful application. And many of those resources are available online. So if you can you can access all of these resources by scan the QR code on top. So I know we're running out of time. Thank you so much for everyone's. One last question for our panelists, if you can. If you can share with us, what would you pass on to our next generation of nurses? You know, if one important advice you wish someone had shared with you or told you when you first started your nursing journey. It could be about a great interview tips, or it could be, you know, overcoming nursing challenge, specialty units that is a great place to be.
Okay, I'll go first.
Thank you.
You know, when we're in nursing school, they instruct us a lot about having, you know, respecting the patient, respecting the patient's privacy, you know, the integrity of the human body and mind, body and soul, and it's in our interactions with our patients that we have an impact, and we usually have a daily impact. Sometimes it's over time. What I didn't realize in my career would be how much some of those daily impacts, how in treating people with respect and dignity, that they remembered those interactions. As you recall, I was an oncology nurse, so most of my patients had no hair, no eyebrows. I would probably, and of course the color of their skin, more paler than usual. And I could recognize, and I did pediatrics, so I could recognize the children, usually by their parents. Oh yeah, I know, that's so-and-so, that's little Johnny, Mary, okay? And they're growing a little bit, but not too much. Over time, and over years, I've had patients and families come to me. I had a young gentleman walk up to me, and he said, "Nurse Lorinda?" Oh my God. This is like about 10 years ago. And this is a big dude, 5'9", shoulders. I hadn't been called Nurse Lorinda in a long time. And I said, yeah, I guess that's me. He said, "Don't you remember me?" And I said, "Tell me a little bit more about yourself." And he said, "You know what? That's what you used to say to me every day." And the little kids, I used to say, "Tell me a little bit about yourself." And it just came out of my mouth. He said, "That's why I loved you, because every day you wanted to hear about me. You wanted to hear about what came out of my nose, what came out of my butt, everything. You wanted to hear about me." And he said, "I remember you." And I was a nurse, I was a patient. I had he had cancer in his legs. And he walked with a limp, but I don't remember. And he told me, so if somebody would have told me while I was in nursing school, the impact that you make on a daily basis is going to have an impact on someone's life, their whole life. I don't think I would have been like, "Oh yeah, of course, I'm the nurse. I make people better. I give them medication." I was all about the quick fix, the quick task, finishing what I had to do. Did I do my assessment? Did I make my care plan? Is my patient okay? Are they clean? Are they dry? And then I'm a good nurse. It wasn't in doing those tasks that made me a good nurse. It was in my interactions, the communication, the integrity, and the respect that I gave my patients that has come back to me in like fourfold compared to what I wrote in a care plan, you know. So,
Eunah, Irie, anything to add? Great story.
Thank you. Yeah, and I was very surprised because I had the same thing on my mind, but a little bit different view. I was like, I want to have a pride because not that how much you get paid, not that how you called, but the impact you have on somebody else's life. We just think about patient only, but look at the care you provide, education you provide. It's not just the patient itself, himself or herself. It's a family, and sometimes it's a whole community. So because of that, I want you guys have a pride and to prepare yourself well and perform excellent job. is what I want to say.
Those are great tips and takeaway. We're running out of time, and I see that there's a lot of anxious audience out there. I'd like to open up the floor for just a few minutes. Oh, Irie, yes.
It's okay. Impact, definitely, not just with patients, but also your colleagues. COVID was a very intense moment for the world, and being in the medical ICU, we were nearly the COVID ICU for a very long time. And a big part of that was making sure that my colleagues were taken care of. I had a friend who hadn't seen her family in a long time, and so I made sure that she didn't have to step in a COVID room just to make sure that we were taking care of each other. And so impact, definitely. As for tips just for your career, don't take obstacles or friction as any failure. Use it as an opportunity to expose what you might want to get better in. And if you think that way long term, you might be a staff developer in less than 10 years. Growth is always out there for you.
Thank you. Great tips. We'd like to open the floor up for maybe a few questions. So, Oriana, if you can hand the microphone. Great. Thank you.
Hello, I'm Jonathan. This is for Lorinda specifically. Just what would you say is the difference between an administrative nurse and a nurse manager? And what is, just out of curiosity, what are some of like your roles, duties are like? And what would qualify as experience for that? As I see, there's actually a job posting for one.
Administrative nurse is kind of a general term. So usually a nurse manager manages a work unit or a certain specialty area or multiple units within a specialty area. So their responsibility is for operational issues on a specific work unit or work units, meaning they're scheduling, they're mentoring, they're training a group of nurses and other healthcare providers within a work unit. An administrative nurse works alongside those nurse managers, but doesn't have any direct patient care responsibility. So I'm more, I've been in roles that support management and leadership, but I don't have any operational responsibility to patient care. I have responsibility to that manager or director to provide them information so they can make better operational decisions. So I provide information about, so my expertise is workforce. How many new grads do we have graduating out in the Bay Area? How many people are we hiring? How many people are we transitioning? What are the employment standards that we need to meet those areas of expertise? How do you get into a role like mine? Mostly because you've had some experience working in leadership or an administrative role. Administrative roles are things like care management, infectious disease. So you're not taking care of patients, but you are in line with patient care and providing support to those patient care providers that are in work units or in clinics.
Yeah, we are a public entity, so all of our information is posted and available online. You'll be able to see the job description, and if you log on to the QR code, you'll be able to go under job specifications to see all of our jobs descriptions. Yeah, thank you, Lorinda. Maybe another question, just one more?
Thank you so much for sharing your experiences. I wanted to ask, what does the clinical support look like for nurses switching specialties and how candidates can make themselves competitive?
Well, I can only speak to critical care, but we do get a lot of transfers from within our enterprise. A lot of the times, if you're not critically care versed, so let's say I come from med-surg or let's say rehab into critical care, we actually send you through the program. And so you would be with me and the other staff developer and we would go through that. The goal is to make sure that you're prepared, right? We are dealing with patients' lives, so patient safety is our #1 concern. And it wouldn't be fair if we were put on the floor without being well equipped. Even further than that, we make sure that you're paired with preceptors. We assess where your experience is. And we also want to make sure that our preceptors are well-versed in teaching in critical care. So we have 2 different classes, one that's specific to being a good clinical partner and one that's specific that I run that's just on critical care. And so the goal is to support all areas that are involved with onboarding, even transfers.
Thank you for the questions. That's a great ones.
Can I add a little bit?
Yes.
So this is my fifth hospital I've been working in my career, and the first public system. I experiencing more opportunity and opening for the employee already. So other hospital, when you want to change the specialty, I don't think there is for you to apply for it. Usually it's just new training program, but within county, I see that when there is a new training program opportunity, it opens up within county. So I will say the county support that kind of transfer very strongly.
Thank you, Eunah. And everyone, I know there's a lot of questions, but our team is available if you have any follow-up questions. For more job opportunity and application information, please visit our website or stops by one of our resources table. But this concluded our nursing session. Thank you again, everyone. We hope this session has provided you with a better understanding of our nursing and healthcare system, the opportunity available. If you are considering a career with us, know that you join a team dedicated to excellence. As we conclude the sessions, I'd like to thank you, our distinguished guests today, for joining me on stage. Your valuable insight, your experience, story truly brought the sessions to life. We're so grateful for your time. And thank you everyone for being a part of today's event. We wish you much success in your career search. If you're interested in opportunity for internship or tip and tricks on applications process, please stay for our next spotlight session. And thank you. Have a wonderful day.